This session is on practice-informed research. We'll take a look at research on family preservation and in-home services in child welfare and see how that work has evolved over the last 30 years. First, some context. So following intake, in which there is investigation of child maltreatment allegations and assessment of the risk of future harm to children, child welfare cases can be closed, meaning that they're not open for services. Perhaps families are given referrals to community agencies, or they can be opened for in-home child welfare services while children remain in their own homes, or they can be opened for out-of-home services when children are placed outside of the home, perhaps with supportive services to families in-home as well, and perhaps with referrals. So in-home services are usually provided in cases that are thought to pose moderate risk of future harm to children. The purpose of these services is to monitor children's safety and improve child and family functioning. In Pennsylvania, there used to be two types of in-home services, and now these two are combined. The old SCO services, or services for children in their own homes, involved 1 to 3 hours of direct contact between family members and caseworkers every week for 9 months. Family preservation services were more intensive, involving 7 to 15 hours of direct contact every week over 3 months. Family preservation services were developed in the 1970s in Tacoma, Washington. The home builders model was developed by Jill Kinney, David Hapola, and Charlotte Booth, who published a book on this model in 1991. Home builders started with families of juvenile delinquents, and early results suggested that family preservation services prevented unnecessary out-of-home placements. Studies in the late 1970s showed that 70 to 90% of the families who went through home builders remained intact 1 year later. So this home builders model was promoted by the Edna McConnell Clark Foundation and the Annie E. Casey Foundation as a solution to foster care, or foster care drift. In child welfare, there was a family preservation movement in the 1990s in response to increasing foster care caseloads. This movement was aimed to address problems related to child maltreatment in the home and to alleviate the need for out-of-home placement. Family preservation services used a crisis intervention model. That is, they were intensive, short-term, and multifaceted. And the crisis was thought to be the imminent risk of out-of-home placement of one or more children. But questions can be raised about whether this was truly a crisis for the families, many of whom had been involved in the child welfare system for many years. So let's take a look at some hallmarks of family preservation services. These services involve immediate response to families after referral, so caseworkers are available 24 hours a day, 7 days a week. The services are intensive, as I've said, involving 7 to 15 hours a week of direct contact between family members and caseworkers. In order to accomplish this, caseworkers have low caseloads, 4 to 5 families for a full-time worker. Services are home-based instead of office-based. Workers go to families' homes. They're said to be family-centered instead of child-centered, but the truth is they're really mother-centered. Most family preservation service workers worked with mothers. And service is brief, lasting 8 weeks to 3 months, and involves a mix of concrete and clinical services. Concrete services involve material aid, provision of food and other necessities. Clinical services involve counseling, advocacy, and so forth. And it focuses on empowerment, helping families learn to negotiate service systems on their own so that after family preservation work is completed, they are able to advocate for themselves. Here are the expected outcomes of family preservation services. It was hoped that these programs would reduce out-of-home placements, also reduce the subsequent maltreatment of children, so that children who remained in their own home would not be subject to future reports and substantiated reports of maltreatment. And it was hoped that these services would increase the closing of cases in public child welfare agencies. Finally, it was hoped that in-home services would improve child and family functioning. So let's take a look at the research that evaluated family preservation services. The Home Builders Program observed placement rates 1 year after referral with no real comparison or control group. So they're just looking at placement rates in the Home Builders Program. Then there were a series of randomized experiments designed to really test this placement prevention goal and other objectives of family preservation services. In these studies, families were randomly assigned to family preservation or regular services in child welfare, and regular services could mean anything other than intensive family preservation. So for example, in the Illinois child welfare system, a large Family First experiment was developed and run in the early 1990s. I co-authored a book on this project with colleagues at the University of Chicago. Let me show you the design of the Illinois Family First experiment. At the bottom, we have what we call Tier 1, which is purely descriptive. And here we collected data on all cases in the family preservation program, the program called Family First. And we collected data on all of the programs to understand who the clients were, what kinds of services were provided to them, what outcomes they experienced, and differences across programs in various geographic sites. We also wanted to understand issues in program implementation and service delivery. So across the state of Illinois, over a 5-year period, we collected data on more than 6,500 families in 60 Family First programs. Then on top of that, we ran a randomized experiment to test the effects of this program on out-of-home placement and child maltreatment. Now, this involved a subset of the families and programs in Family First. It included over 1,500 families in 18 programs that were thought to be among the best in the state. And in these sites, families were randomly assigned to Family First or regular child welfare services. And then on top of that, we conducted a longitudinal survey involving repeated interviews with parents in the program and in the control group to assess the program effects on child and family functioning. Now, this longitudinal survey followed each family over a year. We interviewed each parents in each family 3 times over that year. It involved a little fewer than 300 families who participated in 10 of the Family First programs or control groups in the state of Illinois. So here's a map of the state of Illinois showing you where the experiment was conducted. And let's show you the results. So here are the results in terms of placement rates for families in the Family First group. And you can see that at about 3 months after group assignment, about 13% of the families had lost 1 or more children to out-of-home placement. And at a year, that rate was under 30%. Now that compares fairly well with the results that were reported by home builders. So they compared that to what they expected to happen in the absence of the family preservation program. They expected that if a family didn't get into this intensive in-home services program, children would be immediately removed and placed outside of the home. So this dotted line, the green dotted line, is an expectation, not based on data. Well, with a randomized experiment, we could see what really happened to families in the absence of this intervention, because there was a control group, a randomized control group, alike in every way to the Family First group, except for that they did not receive the Family First intervention. And here's what happened. The red dotted line shows placement rates for the regular services control group in Illinois. And you can see that at the very beginning, in the first 3 months, the placement rates for the control group were a little higher than for Family First, but nothing like the expectation, nothing like the green line. And then over time, you see that the placement rates in the regular services group were actually a little lower than those in the Family First group. So, in summary, there were few placements that were really imminent, were really likely to happen right away in the absence of in-home services. And this suggests that these programs had a targeting problem. If there are few families at imminent risk of placement, then it's very difficult to prevent placement. We say that there are ceiling effects on placement prevention. Placement can't be prevented if it's not likely to happen in the first place. Second, there are no significant differences in placement rates between the family preservation and regular services cases, although we see a trend that's going in the wrong direction. The regular services cases actually are less likely to experience out-of-home placement, and family preservation cases are slightly more likely to experience placement. My colleague Stephen Buddy said that he thought this was because these families in the Family First program were given a chance to change, and any lack of progress on their part was seen as failure and could result in out-of-home placement of a child. So let's take a look now at the effects of Family First on subsequent child maltreatment. The graphs look exactly the same as they do for placement. There are no significant differences between family preservation and regular services cases in terms of the recurrence of child maltreatment. But family preservation cases were slightly more likely to have subsequent reports of maltreatment, and slightly more likely to have substantiated reports of maltreatment than regular services cases. So we wondered if this was a case-finding effect. If the greater surveillance, the more time spent in-home with families, and more documentation of conditions in the home could lead to the discovery of more child maltreatment. We also took a look at effects on case closing, another major objective of the program. And we found that 20% of the regular services control cases were never opened for services. Now this means that 20% of the cases in the experiment were deemed to be at low risk of future harm. There were no significant differences between regular services cases and Family First cases in terms of case opening and closing over the long haul. So this means that the family preservation services resulted in an initial increase in case opening of 20%. And the program did not facilitate case closing as was hoped. So the program functioned to provide services to needy families, not to prevent placement or maltreatment. This was a real shift in the objectives of the program. Along with slight increases in placement and subsequent maltreatment reports, family preservation services resulted in increased service costs because it resulted in the opening of more cases for services and the provision of more intensive services to families without reducing out-of-home placements. We also took a look at effects on child and family functioning. Now, this data come from interviews with parents at 3 points in time over 1 year, and these interviews were conducted by research staff, not by caseworkers. We found very few differences between the Family Preservation Services and regular services cases in any aspect of child or family functioning. And wondered, is Family Preservation Service too little too late in some of these cases? Some of these cases were chronic cases of child maltreatment with multi-problem families. And might have been too little because there was virtually no follow-up in these cases after Family Preservation Services. There was a lot of debate about the Illinois Family First study, and it was replicated in several states. Proponents of the family preservation model argued that Illinois was just a bad program in which family preservation services had been poorly implemented. This is the initial argument of some of the home builders developers. But the results of the Illinois Family Preservation Services evaluation were replicated in a federally funded multi-site national evaluation. This study was conducted in New York, New Jersey, Pennsylvania, Kentucky, and Tennessee. And it included 2 official home builders replications. The results were the same as the results that we found in Illinois. In fact, no rigorous studies show positive effects of home builders or other intensive family preservation services on the intended outcomes. So we then took a look at the effects of certain hallmarks of family preservation services. Family preservation services provided brief treatment that was intensive and included the provision of concrete services. So we took a look at these features to see if they were related to outcomes, and they are not. So the length of service, the intensity of service, and the provision of different concrete services is not related to outcomes of placement, child maltreatment, or case closing. Then we took a look at effects of the family preservation programs for subgroups of cases. We looked again at what I'm calling the structural characteristics of family preservation. These are duration, intensity, and number of concrete services, and found again that these are not related to outcomes. They're not related to placement, maltreatment, or case closing for subgroups of cases. And the subgroups we took a look at were caregivers with cocaine problems, because that was a big deal in the early and mid-1990s, for caregivers with cocaine-exposed infants. Another subgroup were families with housing problems. A third group were families with parenting skills problems or deficits, and many of these cases were young mothers and teenage mothers. And the fourth subgroup of interest were caregivers with serious mental illness. So again, for these subgroups of cases, we found no relationship between the characteristics of family preservation services and outcomes. And there were no subgroups for whom family preservation services were more effective than regular child welfare services. So if these structural characteristics of family preservation services don't matter, then what does? Well, in conversations with practitioners who worked in these programs in Pennsylvania, Illinois, and elsewhere, it was suggested that one feature that might matter is caregivers' readiness for change. So caseworkers told us that readiness for change, or the stages of change, should predict outcomes in in-home services, that we should expect more progress, that is, better outcomes, when caregivers are ready for change at the start of treatment. And when caregivers are not ready for change at the beginning, progress could be measured in terms of increased readiness for change, but we wouldn't likely see much progress on other outcomes. So we measured stages of change in a sample of about 375 families in Philadelphia County, and we found that the stages of change, as articulated by Prochaska and DiClemente, aren't discrete in a child welfare sample. That, in fact, caregivers can be in multiple stages at once. And if that's the case, you don't really have a stage theory. Stages aren't discrete. We found that problem recognition, that is, whether the caregiver thought that she had a problem related to the care of her children, and readiness for change were not closely related. So that caregivers could say, I think I have a problem, but I'm not interested in working on it. Or they could say, I don't have a problem in raising my children, and I'm trying very hard to do better. These patterns are called illogical patterns in the stage of change theory, but we saw them in child welfare cases. So what else matters in in-home services and child welfare? One thing that might matter is the relationship between the client and the caseworker, and important qualities of that relationship, often called the working alliance, include affective bonds, that is, how much the people like and trust each other, whether they agree on the goals of their work together, and whether they agree on the tasks of their work together, or what they should do to achieve those goals. So measures of the working alliance predict outcomes in psychotherapy. And we took a look at this, at how the alliance might work in child welfare and in-home services. And here the hypothesis was that positive working alliance between client and caseworker in in-home services and child welfare should predict better outcomes. So we collected data on this over several years and found that most relationships between caregivers and caseworkers were actually quite positive from the client's perspective, which was a surprise. The myth is that child welfare clients don't like their caseworkers, but that's not what we found in Philadelphia County. We found a weak association between qualities of the relationship between clients and caseworkers and outcomes. So there's a weak positive relationship showing that more positive alliances are associated with slightly more positive outcomes, but we have a chicken and egg problem here. Positive relationships predict positive outcomes, but also positive outcomes predict positive relationships, so it's hard to unravel that. Another thing that might matter in in-home services and work with child welfare clients is the extent to which the client is participating in the treatment. So how active or involved are clients in intervention? And here a hypothesis is that greater levels of client participation should predict better outcomes. We have data on this from the family preservation studies, showing that greater caregiver involvement in treatment planning predicts better caregiver compliance with expectations of treatment. So, in other words, when caregivers, usually the mother, are involved in developing plans for the intervention, the caregiver is more likely to keep appointments with caseworkers, more likely to complete assigned tasks, and more likely to cooperate with caseworkers, according to the caseworker. So that compliance predicts fewer reports of child maltreatment, but there are no differences in the substantiated reports of maltreatment. Caregiver compliance also predicts fewer out-of-home placements. So here it appears that caregiver compliance affects caseworkers' behavior, that is, whether caseworkers report subsequent child maltreatment and place children. But it doesn't necessarily affect parenting behavior because we find no real differences in child maltreatment. What affects clients' participation in intensive in-home services? Emiko Tajima and I did a study of this using a large data set from Illinois, and we found that client characteristics that predict low levels of participation in in-home services include caregiver substance abuse, mental health problems, and lack of extended family support. But there are also caseworker characteristics that predict greater or less client participation. So caseworkers who have a strengths orientation versus a deficits orientation toward their clients have clients who will participate more actively with them. Caseworkers who report that they have adequate supervision and autonomy in their work also have clients who participate at higher levels with them than caseworkers who feel that their supervision is inadequate and that they have less autonomy. There are also program characteristics that are related to caregiver participation. So in-home services programs where workers have low caseloads, where workers provide advocacy services for clients and provide counseling services for clients, have clients who are more actively involved in the intervention. In our study, Emiko Tajima and I found some interactions between the race of the client and caseworker, the region in which they worked, parents' age, and worker and program characteristics in terms of client participation. So where are we going? Back to the future. Family preservation services really resembles in-home services for multi-problem families that were developed in the 1950s, notably in St. Paul, Minnesota. And they have their origins in the friendly visitor services of the early 1900s, described in Linda Gordon's book. In the 1990s, a prominent psychologist proposed a fix for ailing family preservation services and child welfare. He said, the family preservation services are not working in child welfare. They don't have demonstrable effects on out-of-home placement, child maltreatment, case closing, or family functioning. But what we could do to fix the situation is to install a proven, that is, evidence-based model of in-home services in child welfare. And the model that he recommended was multisystemic therapy, a program developed initially for juvenile delinquents in the 1980s, just like home builders. We'll come back to the multisystemic therapy story next week, but for now, here are some conclusions. In-home services, even intensive in-home services, are unlikely to be enough to change chronic socioeconomic, social-emotional, or substance abuse problems. Our expectations for short-term individual and family treatments have been overblown. The story of family preservation services is that we wanted a quick fix for chronic, multi-problem families. On the other hand, I would argue that in-home services are necessary in child welfare, even if they don't have the effects that we had hoped. That's because we have to look in vivo at children's living conditions and parent-child relations. We have to see that in the home in order to make thorough assessments. Also, since the so-called structural characteristics of family preservation services, that is, the intensity, duration, and mix of services, don't really affect outcomes, we recommended that services could be provided on a more flexible basis. Their intensity and duration could be tailored to individual family needs. And in Philadelphia County, DHS took up this suggestion. They combined family preservation and SCO services to provide a larger but more flexible program, and we're concerned about how to hold caseworkers accountable for service decisions. That is a difficult question to answer. But the idea here is that families might need intensive, complex services one week and need a little bit less the next week, that family needs aren't stable over time, and that the service system should be flexible enough to respond to individual family needs. So here I've just described for you a program of research that evolved over 30 years, and you can see how the questions changed from does family preservation services prevent out-of-home placement, to what are the characteristics of in-home services that might relate to outcomes, and what are some of the subgroups of cases that might fare better or worse than others. To what other kinds of features of programs might matter. Does the client's readiness for change matter? Does the relationship between clients and caseworkers matter? And what about client participation? What do we know about the characteristics of clients, workers, and families, and programs rather, that affect client participation in in-home child welfare services? The point here is that research can help us answer and refine questions about program processes and outcomes. Thanks. That's all for now.